The skin is a vital organ of the body that protects it from any unwanted external components. But like every other part of the body, skin ages as well. This is evident by the formation of wrinkles, especially around the face and neck. Wrinkles form because the skin loses its elasticity as the person becomes older, and while this is normal, it may be aesthetically problematic for many people. Over the years, several techniques have been developed for treating wrinkles and age-related skin changes, and one of the most common methods is with dermal fillers. So today, we're going to be talking about some of the pros and cons of dermal fillers, what they are and how they work. Dermal fillers are a gel-like substance that's injected into the skin to fill out the wrinkles and make them smoother. The main component of these fillers is hyaluronic acid, which is a naturally occurring polysaccharide that's present in your skin and cartilage. Fillers are mostly temporary as they eventually get absorbed by the body, and these fillers have a time limitation of about 6 months to 5 years. Following the degradation, the skin will go back to its wrinkled stage, so you will need reapplication. However, sometimes your dermal filler procedure can go wrong, which can result in an abnormally undesirable appearance, like with overfilling syndrome, where you see those very puffy lips, or you just put too much filler in and it goes to the wrong spot. And so in those cases, the user might not like the way the filler looks, so doctors would often use what's known as hyaluronidase to dissolve that filler back into the body. Hyaluronidase is a family of enzymes that helps in dissolving hyaluronic acid, which again is the most typical type of dermal filler, from the body. It was discovered in 1971 as a substance that can catalyze the degradation of hyaluronic acid and has been long used to increase the absorption of drugs into tissue and reduce tissue damage in case of unwanted drug leakage into the surrounding tissue. Hyaluronidase is injected subcutaneously, which means just under the skin. Hyaluronidase dissolves a dermal filler made of hyaluronic acid by first accessing the intramolecular bonds within the acid itself. The rate at which it can dissolve a hyaluronic acid filler depends on the number of cross-links between the hyaluronic acid itself and those molecules, and so the concentration of hyaluronic acid is also very important. The greater the number of cross-linking, the more difficult it will be for hyaluronidase to dissolve the hyaluronic acid into basically its individual components. The same goes for the concentration of hyaluronic acid as well. The more concentrated the hyaluronic acid of the filler is, the slower it gets dissolved by hyaluronidase, where it can take up to 1 to 4 dosages of hyaluronidase to get rid of it completely, and the treatment generally takes up to 10 minutes. This is important because while dermal filler is very easy to use and it is a very quick solution for many people, you have to also consider what if it doesn't work out the way you want it to, and how long would it take to get rid of it completely, which can take some time. There are mainly 3 ways that we can get our hyaluronidase enzymes for use in hyaluronic acid: mammalian, or from other mammals, hookworms or leeches, and microbes. The recombinant human hyaluronidase has more purity, nearly 100 times more so than bovine preparations. If you remember back to high school biology, recombinant genes are basically when we take the gene for producing hyaluronidase and we give it to, say, a microbe, and then that microbe is now producing hyaluronidase. Scientists have been doing this for years with insulin. It's how we got mass production of insulin. We've been doing it with human growth hormone from the pituitary gland, and so using recombinant genes is a very common way of harvesting mass production of enzymes or biological chemicals. Hyaluronidase has a short half-life of only 2 minutes, and that just means that within those 2 minutes, almost half of your hyaluronidase would have been absorbed or used up, and this effect lasts for 24 to 48 hours. Since it lasts for a longer duration, even with a short half-life, even a low dosage of hyaluronidase can provide action for a longer duration. This is important because if you remember, hyaluronidase has a very bad reputation for a number of reasons, but I think it's quite misunderstood. So why do we use hyaluronidase anyway? It has multiple uses in aesthetic practice. This includes its use in resolving side effects that occur due to dermal fillers. So the most common one that we talked about, basically you got cheek fillers done and now you look like one of the Bogdanov brothers, or it just looks very crazy. It's too much. You have overfilling syndrome, your doctor put in too much, whatever the case may be. Now you have to use hyaluronidase, which is again injected subcutaneously under your skin to get rid of that dermal filler and have it dissolve back into the body, so that way you can work on it again, try again, maybe use less filler this time. Hyaluronidase is also used in cases of vascular occlusion, scattering of light, blindness due to periocular embolism from hyaluronic acid, unwanted cosmetic outcomes such as that example I gave with the filler in your cheeks, or the delayed onset of nodules, or a immunogenic reaction to the dermal filler itself, in which case you have to get rid of that hyaluronic acid to avoid your body thinking that it's being invaded by some kind of strange foreign substance. However, while it does have a lot of uses, it does have some negative factors, which is why it gets a bad reputation. These are mainly because of the side effects or improper techniques that are used when applying it, which is one of the main causes. The most common adverse effect of the application of hyaluronidase are injection site reactions, headaches, fatigue, nausea, fever, severe adverse reactions like hypersensitivity or anaphylaxis, hyperviscosity, or thromboembolisms may also occur, and thromboembolisms are basically blood clots that are quite dangerous. Hyaluronidase can also cause thrombosis, which is basically a blood clot that travels around your circulatory system, and as you can imagine, that's very dangerous for people with blood clotting disorders, prolonged immobilization, so they just sit on their chairs for extended periods of time, like a desk job. It can also occur in those of advanced age, so you're quite old, or cardiovascular disease. If hyaluronidase gets injected into veins, it can disintegrate immediately and halt the enzymatic property, which is the whole point of using it in the first place. This action, however, can also cause inflammation, which can be quite scary as well. One of the more immediate side effects that can occur after injecting hyaluronidase is visible swelling and bruising. These swellings and bruisings generally subside within 48 to 72 hours depending on the area that it was injected into. The bruising also depends on how much filler needs to be dissolved. Regardless of the amount, it can take up to 2 weeks for the dermal filler to be dissolved completely, and there may also be an initial pain or stinging sensation when you're injecting the hyaluronidase itself. However, that's going to resolve itself after 24 to 48 hours, which is pretty standard. Improper injecting techniques can also cause side effects on the injection site, which many people attribute wrongly to hyaluronidase being at fault. Local injections of hyaluronidase can cause side effects like itching and allergic reactions. The incidence of allergic reactions is 0.05 to 0.69%, and it's relatively quite uncommon. Cases of angioedema, which is basically when the blood vessels leak a little into the tissue, have also been reported to occur at low frequencies of less than 0.1%, so nothing to really worry about there. The most common hypersensitivity reaction caused by hyaluronidase is a type of swelling, erythematous edema. This occurs after 1 to 2 hours of use and is often treated with steroidal injections. You can test for allergic reactions by performing a skin test using 3 units of hyaluronidase before actually using the injectable one. To prevent these side effects, it is essential to get these injections from those who are certified for the job and have enough qualifications and experience to conduct it. The user must be adequately hydrated before any dose of hyaluronidase is injected. If proper guidelines and techniques are followed, then there's a minimal chance of actually going through these very scary sounding side effects. Aside from the side effects, this is an important factor that you should all consider. Many patients are dissatisfied with their appearance after hyaluronidase has actually successfully dissolved the fillers without any significant complications, meaning that you've had dermal fillers on your face, they're right there right now, and the hyaluronidase has done its job in dissolving it, but you feel less satisfied than when you had dermal fillers previously. Real Self reports a high rate of not worth it ratings with hyaluronidase in comparison to the high worth it ratings of dermal fillers. The reason for this may be that patients get used to the filled out appearance of their face and have a hard time adjusting to the post-hyaluronidase flattened or deflated look. While the side effect is subjective, many patients report similar issues, and perhaps the best approach to this is avoiding overfilling with dermal fillers in the first place by trying to achieve a more natural look. So there you have it. That is our breakdown on hyaluronidase as reported by our resident doctor at CUVS, Dr. Sony Sherpa, who is our specialist on this topic. And basically this is part of a new series we're doing on the channel to talk more in depth about the surgical and non-surgical options that people have. And I feel like hyaluronidase is one of those things that people don't know anything about. We know all about dermal fillers, but how much do you really know about hyaluronidase? Me personally, not a whole lot until we made this video. Regardless, if you want to talk more about hyaluronidase or anything that concerns you aesthetically in that matter, then you can always order a Koos aesthetic report, or you can seek out consultation with one of our aesthetic professionals, many of whom have worked at the clinics that actually administer dermal fillers or hyaluronidase and are very knowledgeable on this topic. All of that and more over at the Koos website. Until then, I'll catch you in the next one.